Hey, good evening, everybody. Let's talk a little bit about the changes that we're seeing in the vaccine landscape of the United States. So, people have probably seen that CDC has made some changes and are no longer recommending, which doesn't mean that you can't get them, but they're no longer recommending for all children to get a certain group of vaccines, that being RSV, flu, COVID, hepatitis B, hepatitis A, rotavirus, the second HPV, and meningococcus. Pretty impressive. I remembered all of them. There's way too much to talk about with all this and unpacking it. But first, before everyone panics, at present, you'll still be able to get all of these as long as you're talking about with your doctor. And that's something we'll talk about at the end of this. There's a couple things I'm concerned about. One, when a place like the CDC does this, there's going to be an erosion of trust that's already happening with vaccines. And that's going to really be problematic for a place where vaccines will need to work by creating a blanket coverage, and we're going to have a lot of holes in our blanket. The second thing is there's not as much transparency about why they even chose these. I mean, there's been a lot of talk about the hepatitis B vaccine and why they chose that. And there's been a lot of talk about Denmark and Japan and their schedules. But the truth is, we aren't Denmark or Japan. We don't have universal health care. And that's going to lead me into the rest of this conversation, which is one of the main things they were pushing, which sounds like a great idea, which kind of already exists, is something that's called shared clinical decision making. And what that basically means is a parent should get to choose, which of course they should. And it means they should have informed consent, which of course they should. And that children should have their autonomy, which, oh, wait a minute, no, they don't have that. Children never really have autonomy. And that's a whole nother issue to talk about philosophically and ethically. A child never really gets to choose whether they can protect themselves or not. They're at the whim, which usually is a good thing, of their parents who will try to protect them. But sometimes parents' misinformation, everything could cause holes in this blanket we were talking about and can be worrisome. So I'm going to use 3 of the examples of some of the vaccines that are no longer recommended, which could be problematic. First, the RSV vaccine. So RSV vaccine isn't mandatory anywhere right now. And the vaccine that we're using on children isn't really even a vaccine. It's a monoclonal antibody, a long-acting monoclonal antibody that they give at birth. And it's really been around for the last 2 years. It has literally changed winters in the Northeast United States, because that's where I work, where RSV used to be, when I was a resident, something that would populate an entire floor of pediatric patients in a hospital. And now babies barely get sick with it. It is a remarkable advent. And it was being pushed on babies before they left the hospital. So just in case they would get exposed, they wouldn't be hospitalized in that first year, especially during this time of year. But, I think that'll still be offered, and hopefully that is something that will protect and continue to go forward. But as we said, there's going to be some erosion of trust. The second is rotavirus. Rotavirus is the oral vaccine that if you have children at 2, 4, and 6 months, they get a drop of this oral rotavirus vaccine. Rotavirus is kind of like the norovirus of the past, although it's not that far in the past, it still exists. Norovirus that gives you vomiting and diarrhea. Rotavirus was something that used to come around about April, and again, the floors of the hospital would be populated with babies with vomiting and diarrhea. And to give you an idea, prior to the advent of the vaccine, there were 70,000 hospitalizations a year in the United States from rotavirus due to dehydration. Now you may say, okay, if we don't get that, what's the big deal? Well, more people will spread, more people get hospitalized, but there's a bigger issue. A lot of the people who are going to get hospitalized are the ones that don't have access to care. And if they have issues with their insurance, which we do know insurance things are kind of up in the air right now, how are they going to get care? And dehydration is something that can terribly affect a child. Very dangerous. So finally, let's talk about meningococcal vaccine. Meningococcus is a bacteria that causes meningitis and something called meningococcemia, which is where your blood basically stops clotting and you go into a state of sepsis where your blood pressure drops, your heart rate goes down and you go into multi-organ system failure, and I'm waving a flag of skull and crossbones right now. To give you an idea, I've seen fulminant meningococcemia 8 times in my career, 7 people waving the flag with skull and crossbones, even though they made it to the hospital. We all know about the meningitis vaccine. Our kids get it before college, right? And they get in there. Why would we stop making this mandatory? That's a good question. We don't know. Because that's one of the big problems that's going on in the CDC and the FDA right now, is that there is a lack of transparency. They throw some news out there, but they're trying to control the narrative. They'll speak about poison, and then they'll try to control the narrative. And if you don't believe me, in the New England Journal, there was just an article written by 12 of the last directors of the FDA, 12 of them. That's a lot. I wouldn't even think there were 12 people still alive that were doing that. And they were all worried about the transparency and some of the motives that were going on in the current FDA, because one of the things that was put out by Dr. Prasad, who runs the CBER in the FDA, was that if you don't agree with the way that they're taking in the messaging and doing the testing, you should put in your resignation if you work for the FDA right now. That sounds kind of scary to me. So for right now, I'm following the American Academy of Pediatrics guidelines. I hope you will too. And as far as the shared clinical decision-making, I hope this gives you some informed consent. Believe it or not, pediatricians have always been giving informed consent to their patients. We hand out vaccine information sheets by mandate for all vaccines. I talk about my vaccines with all my patients before they get them, as far as what they're protecting against, what side effects to expect. And that's always been the way. But this erosion of trust is going to have consequence. I hope we can act on this and really, as a culture, come together, because one of the reasons why Japan doesn't mandate vaccines is because they do them all anyway. Good night.